start in just a minute. Okay, everyone, thanks for joining us this afternoon for the National Alliance to End Homelessness webinar on opportunities to improve your system's performance through the fiscal year 2018 COC NOFA. Today, I just want to do a little housekeeping before we start. Just FYI that all your lines are muted. And if you want to pose any questions, we should have some time for questions at the end. We're hoping so. This is a 1-hour webinar. So if you have any questions, please go ahead and put them in the questions box, and we will try to get to those questions that we know the answers to. And if we don't, we can compile them and send them on and at least let HUD know what you're asking. And at the end, the webinar and the slides and some additional resources will be posted on our website at endhomelessness.org. So as I said, I'm Christy Schulenberg. I am a Senior Technical Assistant Specialist in the Center for Capacity Building here at the Alliance, and I am joined by my colleague and boss, Cynthia Nagendra. She is the Director of the Center for Capacity Building, and I'm going to hand it off to her. I'm also sorry, Cynthia, you were muted. You're now unmuted.
Thank you. Hi, everybody. I wanted to start off by saying that we at the National Alliance to End Homelessness are very well aware of how challenging this period of time is for folks. And we also wanted to just make the clear distinction that as we go through this webinar, we are not HUD. We are we very much listen to what HUD is saying, and these are very much our interpretations, what we think that HUD is looking for, but also this is very much our take on what we think is very important and useful in NOFA, and so I just wanted to make that clear distinction. So there might be some questions that are technical that we can answer, and there might be some that are sort of better suited for HUD, and we will kind of try to sort those out as we go through. So we know that you are already all hard at work and knee deep in this year's program, NOFA. Christy and I, who have both helped draft several NOFAs, can understand just how all-consuming, difficult, and let's face it, crazy-making this process can be. And we sometimes call it the no fun season. I've heard many people call it that. The purpose of today's webinar, though, is to hopefully help you step back for just a bit. And if you haven't already, strategize on how to use what we see at the National Alliance as some very helpful opportunities provided in this year's NOFA to build your system's capacity, to increase system flow, to get more people housed more quickly, and to improve your overall program outcomes and system performance. As tough as this process is, there are some very helpful ways provided in the NOFA to plan for better outcomes for people experiencing homelessness in your COC. And we hope to highlight just a few really key ones today. So we'll take you through really quickly some new and notable things in this year's NOFA, some strategies and resources to build your community's capacity, opportunities for improving your system, reallocation, and some other things, opportunities for improving your system through creating flow. We'll have some examples of how to create flow through your system using some of the opportunities in the NOFA. And if we have time, hopefully we'll have some questions, but again, put some questions in the chat box, and we'll see if we can answer them now or later or send them to HUD, and we'll talk a little bit about what's next. Before we begin, we like to always just sort of lay out the acronyms. So if in case, I'm sure most of you know these, but just in case, we wanted to just lay these out here. COC is continuum of care, NOFA is NOFA funding availability, FPRN is final pro rata need, rapid RRH is rapid rehousing, PHRRH is the joint component, PSH, permanent supportive housing, and CH, chronic homelessness. And briefly, we'll go over some important deadlines that I'm, again, sure that most of you know, but just wanted to highlight them again. So the NOFA release was released, as we know, on June 20th, and I know you all are getting tons of emails telling folks where, what's due and when it's due. But just so you know, on or before September 3rd, 2018, a notice to all project applicants as to whether their projects are accepted, ranked, rejected, or reduced is due. On or before September 16th, you have to post online and notice to your community of your entire COC consolidated application, priority listing on all project applications, and by September 18th, 8 p.m. Eastern is the deadline for submission. As we know, approximately $2.1 billion is in funding is available, and bonus funding in the form of 6% of your FPRN. So here are some new and notable things in this year's NOFA. There are, again, HUD has put out homeless policy and program priorities, and while they are pretty similar to past years, there are some differences. The policy priorities are ending homelessness for all persons, creating a systemic response to homelessness, and that's really looking at your system performance measures, strategically allocating and using resources, such as developing partnerships with your PHA, that is very much highlighted this year. We'll talk about that a little bit later. And using a housing first approach. Again, this is some of this is stuff from before, and just some new kind of strategic priorities have been emphasized. There is a domestic violence bonus project of $50 million for the country. We will, at the National Alliance, be writing a blog about that. If you have questions about that, just let us know, but we will be releasing something in the next couple of weeks. There's the opportunity to transition, consolidate, and expand project grants. And efforts to prevent and end homelessness should be considering to address racial inequity. We will also be having a blog about that in the next week or so. So we wanted to talk a little bit about strategies and resources to build your community's capacity, and things to keep in mind as you are really thinking about your NOFA. One thing we have said in the past, and we will reiterate during this webinar, is that the NOFA is very much an application for funding, and we know we're very kind of focused on what's going to get us the maximum points, but really it's also to help you create and develop and execute a plan for your vision to end homelessness for your community. And so we really want you to think about how this NOFA is a planning process, and kind of forces you sometimes to really kind of lay down some parameters around what needs to get done and when it needs to get done by, and it kind of forces some communities to really, I know I did this when writing NOFAs, like we should really start this, and this is a good opportunity to get a team together to start this project we've been talking about for a long time. It's a HUD priority, it'll help us in our application, and we need to do it to better our community. So HUD expects communities to use cost, performance, and outcome data to improve how their resources are being utilized to end homelessness. This isn't just about the competition or what points are available for what, but rather what is going to reduce and ultimately end homelessness. So having a plan and focusing on outcomes to reduce homelessness is really key. And to sort of refresh our memories, I'm sure you, again, are very steeped in this right now, what you're trying to do is to make homelessness rare, brief, and one time. And some important outcomes to focus on are reducing the number of people experiencing homelessness, reducing the length of time people experience homelessness, and increasing exits from the homeless system to permanent housing. There's a few other system performance measures, but those are some really key outcomes to focus on. You don't know if your system is really effective unless you're really hitting some targets in those areas. So what decisions during this NOFA process can you make to better meet these outcomes? How do the interventions you currently have impact these outcomes? And these outcomes should be guiding your vision to reduce homelessness. Another thing to focus on is to know what you need. once you have outcomes to focus on, what interventions does your community need in particular to meet the outcomes it wants to achieve? Every community is going to look a little bit different. Conduct your gaps analysis. Data and project performance on the outcomes we just mentioned should drive decisions around what your community needs. COCs can utilize PIT and HIC data, an evaluation of project performance, and meaningful consumer input to determine what your community's specific needs are. HUD sort of can't tell you what your community's needs are. You sort of need to use data to really inform that process. And once you kind of understand what your needs are, you want to align the projects that you're funding with those needs. Determine whether you have the right mix of projects to meet the needs of households experiencing homelessness in your particular community. So look at both the supply of projects that you already have, the demand on those projects from people experiencing homelessness, and who need help in your community, and see if those match. For example, if you have a lot of permanent sort of housing for families, and maybe you applied for that through bonus projects in the past, and you're looking at your community right now, and you're realizing, well, we don't actually have a lot of families experiencing chronic homelessness, and maybe we need, we have long wait lists for rapid rehousing. So maybe we actually need more rapid rehousing and less PSH for families, or vice versa. So you really want to kind of think about what is the need, and do we have the interventions to meet that need?
Great. Thank you, Cynthia, for walking us through that overview and framework for our time together today. So for the next few minutes, we're going to highlight some key opportunities to improve your system, provided in this year's NOFA. So in previous years, regarding the COC NOFA, reallocation of funds meant to ensure improved performance is basically a requirement, and it is the case for this year as well. So we're asking COCs to view reallocation through the lens of, continuous improved performance of your system. So reallocation is really a tool to achieve the best performance of your community's response to homelessness. And if you haven't already gathered in this year's NOFA, performance has increased in the number of points. So in 2017, the COC NOFA allocated 49 points to system performance, and it's 56 points this year. So keeping in mind that this kind of planning really begins when you receive your awards from the prior year, here are some things you can still do even now. So if you haven't already, be sure you have reviewed or go back and review your past year's consolidated application and use this NOFA to develop plans and activities to improve your system's outcomes for the coming year or years. So think of the NOFA, I know it's tough to do this, but to think of it actually as a planning document and opportunity moving forward. So many of you have already started your project review and evaluation process. So take what's applicable in this webinar now and try to implement it moving forward. So if your review doesn't include looking at unspent funds by projects or cost effectiveness, meaning how much each project spends to serve and house an individual or family as compared to other projects serving similar populations, if it doesn't look at utilization, consider including them as factors as a part of your review. Also, if you haven't set community benchmarks for each of the component types, look at your data and consider doing so if you still have time to do that. But just remember to be transparent and clear in your process. And we're going to talk about looking at national benchmarks for guidance in order to do this. So we know that reallocation decisions are very difficult in communities, and even more so when you have high-performing providers. However, not every community has a portfolio of high-performing providers providing rapid rehousing or permanent supportive housing or whatever. And so many communities are still working on standardizing that practice among those component types and ensuring that practice actually matches the standards that you've set for your community. So at a minimum, you want to look at reallocation decisions and take into consideration, like I said, utilization and underperformance. So if you have utilization and underperformance by project providers, can you reallocate a portion of those funds or the total project's funding to create a new project that's based on the data and needs of your community? If yes, to utilization and underperformance, the COC should consider a transition grant, maybe for a new component type, which, as Cynthia said, is an opportunity in this NOFA. Also, remember to make sure that your marketing of the COC NOFA opportunity is really robust. And if it's not, try to beef that up and or make it a part of your planning for next year, because you want to attract new potential applicants. Especially if your community is hesitant to reallocate because there isn't another provider to step in, it's really important to start developing a plan to recruit new providers and or develop the technical assistance and training that's going to increase provider performance. Many of you have already started your project review process. So again, take what's applicable here and try to include it. But definitely want to encourage you to take what we are sharing with you here today and use it as a part of your evaluation and debrief process, which I know you're all going to just jump right on as soon as that deadline is over. So depending on how you answer these questions, whether or not your scoring tools align with HUD's policy provider priorities, or how much do your factors really focus on performance for each new project. You want to make sure that if you're not asking these, you start doing so, in the future, and developing the methods to collect that needed information and data, and creating tools to analyze that. Just a note that if you don't have a NOFA committee that meets regularly through the year to prepare for the competition and the application, use the debrief and evaluation time in this year's NOFA to kick it off or to breathe some new life into it. So the NOFA committee, in coordination with other COC governance committees like a systems performance work group or subcommittee, should be working together to evaluate your current scoring tools and evaluation process, and develop new tools for future competitions. So I think you all are aware that HUD has updated its project rating and ranking tool. So that went out in a HUD Exchange post. But this tool still requires some local customization related to performance benchmarks, and it can always be enhanced. So definitely this is a great starting point. But thinking back on what we've shared so far, think about how you might integrate some of these questions and suggestions into your scoring process. So over the past couple of years, COC's portfolios have changed, right? So many COCs now have portfolios that are either full of rapid rehousing or permanent supportive housing, or both. And everyone is still working towards right-sizing their systems based on their data and their needs. So if you're a community that has a lot of rapid rehousing in your portfolio, we really encourage you to evaluate your rapid rehousing projects using the Rapid Rehousing National Performance Benchmarks and Program Standards. If you look in the GoToWebinar handouts, they are there for you to download. And we do encourage you to use those. These standards are based on what is currently considered promising practice by us, the Alliance, by the VA, by HUD, by the USICH, APT Associates, and other federal technical assistance providers, as well as high-performing rapid rehousing providers. So following these benchmarks and standards as a system will really assist your COC in standardizing practice across your homeless response system, and ultimately allowing for better performance evaluation and cost effectiveness comparisons. If you're a COC that has a majority of permanent supportive housing in your COC portfolio, we really encourage your evaluation to focus on your community's ability to end chronic homelessness. Some key questions to consider as you evaluate your permanent supportive housing projects are, does the PSH project perform well? So whatever your local current benchmarks are they meeting those? Are they cost effective? Do you do a cost comparison among providers? And do they continue to meet a community need? And we're going to go into each of these just in a little bit more detail. So when you're looking at performance, we've kind of outlined here the kind of data and information you will need in order to do a robust evaluation of permanent supportive housing projects. So we have a list of that there and some points for consideration. So as I said before, does your community have performance benchmarks for permanent supportive housing? We hope that they do. but looking at how often do you review them, and based on your data, can they be increased? Do you have project evaluation factors for permanent supportive housing that look at data quality? Do you score on data quality? Do you review both whether the provider has policies and procedures that reflect adoption of housing first principles? And do you have a process that also allows you to ensure that those policies match actual practice? And one way to really do this is to focus on consumer surveys and focus groups. When evaluating for cost effectiveness, please be ensure to capture this list of the data and information needed. Again, these slides will be made available, so you'll have these as kind of a checklist. So some things to take into consideration is, do you have a way in your evaluation process to take into consideration the population that the PSH project serves as it relates to cost? So for example, the cost may be higher in a PSH project where the PSH project is serving chronically homeless individuals. Do you have more than 2 projects serving similar populations? And again, are you doing that kind of comparison? When considering community need, if you have a lot of folks experiencing chronic homelessness in your community, well, if you have any individuals experiencing chronic homelessness in your community, do you have a strategy to end chronic homelessness? So the answer to that is will likely impact your reallocation strategy. Another great opportunity that we're going to go into a little bit more here that this NOFA provides is an opportunity to begin for COCs to begin and or to strengthen an assessment of service needs for participants in permanent supportive housing and to gauge their interest in moving on to a more independent permanent housing situation. So if you have PSH participants who have been enrolled for some time and you've seen a decrease or have participants who have just stopped utilizing case management services, it might be that they don't need the intensive support services anymore, although they probably need the long-term subsidy, but it might be a time ripe for a PSH move-on strategy in order to assist your systems flow. So we're going to have, just take a little poll. We're really interested in knowing whether or not your COC is planning on reallocating any of your PSH to a new rapid rehousing project. So I'm going to launch a poll here in 1 second. And we'd like for you to just take a minute to answer these questions. Collecting responses. We've got about 60% of folks who have answered the poll. I'll close it here in just a few seconds. Okay, I'm going to go ahead and close the poll. We have about 65% of folks responding. And I'm going to share this. Okay, you all should be seeing the poll. So 8% of you answered yes, you are looking to planning and or are reallocating your PSH to rapid rehousing. That's great. Obviously, you all have been looking at your data needs. 58% of you have said no. We can understand that too, as well, as there may not be opportunities in place to move people on or affordable housing issues. Lots of reasons why you wouldn't. 25% of you are considering it. That's great. That is great to know. And 9% said, what? Are you crazy? Not surprised by that either. Okay, so we are going to move on. Okay, Cynthia, I think it's back to you.
Thank you, Christy. And I was just thinking, if people are considering reallocating that PSH project to a new rapid rehousing project and trying to think through kind of how that might work, feel free to contact us, offline, and we can help you think through any questions that you're trying to work out. So opportunities in, I think we are still on the poll slide here. So
I'm so sorry. Let me see.
Okay.
Hide. Is it working?
Great. Thank you.
Okay, great.
So in this year's NOFA, There are actually a lot of opportunities for improving your system. In particular, opportunities to create better flow through your system. So for the next few minutes, we're going to discuss just a few good ways, not all of them, it's not exhaustive, but just a few good ways that we identified to create better system flow with opportunities provided in this year's NOFA. So I thought I would start by just talking about what system flow is. System flow essentially is a description of the way a crisis response system or homeless response system should be efficiently moving people from homelessness to housing as quickly as possible. So how fast are you getting folks who are on the street or in shelter, living in their cars, wherever they might be experiencing little homelessness, into housing? Is there, these are things that everyone's starting to measure, especially because of coordinated entry, which is one of the benefits of coordinated entry. You can kind of see, how is our system really working? Are we really getting people into housing as quickly as possible? And where are the roadblocks? Where are the sticking points? So one question I just want to quickly pose is your system stuck? How do you know if your system is stuck? What does that look like? What does that mean? How do you unstick it? A stuck system may look something like this. You might have some of these things, you might have all of these things, you might have more stickiness to your system. But just to give you a sense, a stuck system may look something like having some of these bullet points. And it's the idea is that you're not having good flow. So you're not moving people from homelessness into housing quickly. You might have wait lists for shelter. That might mean you have not enough shelter beds, or people are just staying for a really, really long time in your shelter, so the beds aren't turning over. But there's definitely wait lists. And wait lists for rapid rehousing and PSH, something that you're really potentially noticing much more, because now that you have coordinated entry and you're trying to assign folks to these interventions in a kind of more coordinated fashion and not by program fashion, you kind of see across your system, oh wait, we have, we're prioritizing all these folks for rapid rehousing, for example, but gosh, the list is really long and we don't have nearly enough. An unchanging or increasing number of unsheltered people. You might be a community that is seeing that the people living outside, which we all feel is unacceptable, but to change that, it requires kind of really reconfiguring your system a bit. So you might have an unchanging or even an increasing number of unsheltered people. We know a lot of communities have actually decreased the number of people living outside, but in some communities, especially on the West Coast, we are seeing that there are increases in numbers of people living outside. And that's not just because of your system, it's because of housing affordability and a whole bunch of other external factors, but there are things about our system that we might be able to reconfigure to unstick that. You might have long lengths of stay in shelter, with most people exiting back into homelessness or to transitional housing, which are both still have homeless status. So you might not be really able to optimize your shelter system, and people are mostly going back into homelessness. Your average length of homelessness is increasing or staying the same or increasing. So one of the key system performance measures is average length of homelessness. And what you want to be doing is decreasing the length of time on average that people spend homeless in your community, because we know the longer that people are homeless, the more difficult it is for them for a variety of reasons. And so you want to decrease that number, but what you might be seeing is an increase. Many people are able to get into shelter, many people are unable to get into your shelter in your community or housing programs. It might be because of eligibility and program policies or high barriers. In other words, a lot of your programs are not housing first. They're not able to take people in, or they're choosing not to take people in because of particular barriers that might be requiring income or sobriety or a number of other things. We know that even PSH programs sometimes, rapid rehousing programs, which are, sort of fundamentally meant to be housing first programs, and we want shelters to be the same, really sometimes just have barriers that are helping people who are inside the programs, but the people who can't get in aren't getting access to them. So this is kind of what a stuck system might look like in several communities, and we're kind of curious if this is your community.
Okay, we're going to launch another poll. Encourage everybody to take it, and so take just a few minutes to answer these questions, please. Okay, we've got about 65% of people who have answered the question, so I'm going to go ahead and close the poll. And I'm going to share that with you. So close to 60% of you said, yes, we have a stuck system. So, then that also tells us that reallocation is a really important strategy for you, to help right size your system. And 24% of you said, no, your system is not stuck. That's a little bit higher than I thought it would be, but that's great to hear. 11% of you don't know. 6 of you said, I'm just too tired to think about it right now. So thank you so much for taking that poll. That's very helpful. We are going to have at the end of this slide deck, I admittedly forgot to put in our email address so that you can get in contact with us. But we will add that to the final slides that are uploaded to our website. And since you have registered for this webinar, we'll also send you a link out and an email out with a link in it to let you know that they're up. But we would be interested in hearing from folks who do not have a stuck system. I'd just be interested in hearing how you have managed that and how you are managing that. So just a little shout out to those communities. We'd like to hear from you. Okay, Cynthia, I'm going to hide this now and give it back over to you.
Thank you. So I think one of the key opportunities that we see to unstick your system and to create better system flow is new in this year's NOFA, which is an emphasis on creating a move-on strategy from permanent supportive housing. One way to create better system flow is to open up PSH beds, right? So PSH beds, as you have probably seen in your community, you could have a bunch of PSH beds, and they're, because they're permanent sort of housing, the nature of them is that people stay in them. So once they're full, sometimes people don't turn over. Now, some communities have sort of average turnover about every 2 years or so, and hopefully most of those people are going back into another housing situation because they no longer need the intensive support, so they've chosen to move on. But many communities are finding that there are people who no longer need the intensive supports of permanent supportive housing and who are choosing to live in a more independent setting and can move on to other permanent housing using either another long-term subsidy, like a voucher, or some other kind of way of making their housing more affordable. They just don't really need, they need the subsidy, but they don't really need those intensive services anymore, especially the project-based ones. So here are some tips from CSH, and thank you very much, CSH, for allowing us to use this material, about how you can build a move-on strategy. I also want to point out that HUD has TA on how to build a move-on strategy. So there are a lot of ways to think about at least getting this started, and you don't have to kind of reinvent the wheel. So yes, I know that this is a lot. I'm about to tell you a lot of things to do that you can't imagine doing in the NOFA season. But just as I'm walking through this, think about what are the pieces we could start during our NOFA season, and certainly write about that in the application, but also get as a way to kind of catalyze and set some urgency around starting this initiative that I know many of you want to start. So first, secure a team and begin to identify resources. Your team should include specific PSH providers that you think are going to be able to work with you on an initiative like this, your public housing authority, which is critical because you're going to need those vouchers, and other relevant government or private funders that might be able to kind of fill in gap funding. You're going to need resources identified such as services funding, vouchers, financial resources for tenants who choose to move on. Second, design the initiative and identify any additional resources that may be needed. You should probably you might want to be doing an environmental scan to kind of determine the size and the scale of the target number of people you want to move on. Remember, you don't have to sort of decide, okay, we're going to move everyone on, or we're going to move 10% on. You can sort of think about, well, we're going to try to move 50 people on this year because we're seeing that about 50 people are turning over, or we can kind of figure out based on what's been happening in the past and what your system looks like to determine an initial size and scale, and you can build from that. You can decide on the eligibility criteria and the application process for that, and very much putting, client choice is very, very important in this process. It's very much about the client choosing to do this. design a services package that makes sense, that's individualized for clients, identify financial resources that will be made available to clients as they make this transition, outlining responsibilities for all partners, this is very critical, including expectations on backfill, set goals and plan for implementation with a timeline. So again, like any plan, maybe you're just kind of figuring out the actual plan and timeline and who's going to do what, and you're, at least getting to get that far. Third is implementation and monitoring, and I know that you're probably, if you haven't started this, you're not going to get into that right now in the NOFA season, but that is kind of the next stage, obviously. So this is a lot for the time frame you have, but again, ask yourselves what you can actually accomplish in the time frame for the NOFA, and use the NOFA as an opportunity to maybe begin to get your team together, definitely to engage your PHA to kick off the process of implementing a move-on strategy and open up some of those PSH beds for the people in your community who really need them. You might have a lot of folks in PSH who are not chronically homeless, or didn't enter as chronically homeless and no longer need the intensive intervention, while you might have a long wait list of people who are chronically homeless and are waiting to get into PSH. So this is something to really think about if this is what if you're kind of stuck in that way. Here are some key tips and advice from a provider of supportive housing and a number of other types of housing in California. The name of the organization is Brilliant Corners, and they are really coordinating and running the Move On initiative in San Francisco. And so here are some key tips and advice that they've given that they think that would be good to share with other providers or other communities who are doing this. From the beginning, build in time for program coordination among all of the partners. There's just going to be a lot of back and forth and tweaking and seeing how things are working and coordinating a lot of the pieces. So build in a lot of time for that from the beginning. Highlight when you're approaching your PHA, highlight the win-win for the PHA and for the COC. For the PHA, the improved utilization rates for vouchers, having constant utilization rates for vouchers is going to be something that a PHA is very, very interested in. Obviously for the COC, there's the homeless preference and getting those vouchers for their folks, but the PHA can really also see a great win in this situation. Establish really clear program flow from the beginning. So how people are going to come through, how people are going to be prioritized, how people are going to come through, from the very beginning, and start up slowly. So if you're going to say, yeah, we're going to do 100 clients in the next, 3 months, that might be too much, right? So just make sure that you're kind of thinking about the capacity, start up slowly, and then build. Set very clear eligibility criteria for who is eligible to participate. Share data and share information as much as possible. And I'm sure this is not surprising. It's a team effort amongst all the partners and requires a lot of really close teamwork across different agencies.
Okay, great. We have another poll. We are really interested in learning about communities who are implementing or are beginning to have conversations about kicking off a PSH move-on strategy. We, at the National Conference, we just had our summer conference here in DC just last week on ending National Conference to End Homelessness, and we had 2 sessions on PSH move-on strategies. The practice session that was highlighted by Cynthia spoke to them earlier, Brilliant Corners. They gave a great overview of how that works at the practice level. And we also had a session on how to implement PSH move-on strategies in a system, and we focused on actually New York City, as CSH is working on a large level PSH strategy there, though even though it was in a large urban setting, there are certainly takeaways from that can be replicated in smaller communities. So again, when you have our email at the end of this, if you are interested in getting the slide deck presentations for those, we would be happy to send them on to you. So for the poll here is we're asking you to answer, does your community have a PSH move-on strategy, or are you planning to start one? For those of you who have a PSH move-on strategy, again, we're going to include our email. We would be very interested in speaking with you further. So if you wouldn't mind sending your contact information and not mind talking to us for a little bit, we'd appreciate that. So take a minute to answer this poll, please. Great. We had about 60% of folks respond, so I'm going to close that poll and share it with you now. So 44% of you said that you have a PSH move-on strategy. We are really glad to hear that. That's a little bit higher number than I was anticipating. So that's great. I really encourage you all to reach out to us when you get our contact information. We would be interested in speaking with you. 33% of you said no. So we definitely hope that you will think about how to start a move-on strategy moving forward so that you can write about that and have that as an effective strategy or a strategy in process in your next NOFA opportunity. And 23% of you said you don't know. So we just encourage you to reach out to your COC system leaders and find out if that's going on and or your PSH providers. So that's great. Okay, Cynthia, I am going to kick it off to you again.
Thanks. So another opportunity in the NOFA that we see to help you create better system flow in your community is the transitional housing rapid rehousing joint component, or joint component for short. So why is this helpful for system flow? Well, first, let me just remind you what the joint component is. It's a combined transitional housing and rapid rehousing in a single project designed to provide a safe crisis housing environment with financial assistance and wraparound services determined by program participants. So the participants are very much choosing kind of what their needs are. There's not required services. And to help them move into permanent housing as quickly as possible, that's where the rapid rehousing part comes in. So it's crisis housing with housing exits. In some cases, that's kind of a dream situation. You want a lot of these things to come together: housing and crisis, permanent housing and crisis housing. It's not intended to replace traditional housing projects that have been reallocated or lost funding in recent years. So it is very much meant to sort of help you think about how to create flow through adding some crisis beds and really helping you have some housing exits from those beds. And the joint component is really intended and can help you create system flow by adding low barrier and housing focused crisis beds or shelter beds to your system if you need more. And also provides resources for housing exits so people won't get stuck there, right? So we can't just add shelter or crisis beds without thinking about the housing exits. Steve Berg from our vice president wrote a blog about this in our Unsheltered blog series a few weeks ago, and I encourage people to look at that. It talks about sort of every bed you add, you really want to think about the housing exits that are going to get people out of there. So this is really going to help those communities that are stuck in these ways. It helps address communities with large numbers of unsheltered homeless people, because then you can have those crisis beds to help, get people off the street. And again, you might have a lack of crisis housing capacity to do that. It also might be that you have a lot of lack of permanent housing exit strategies for people in crisis housing. And so there are some people who might need some time to transition, and they might choose to stay a little bit longer, and that's kind of up to them. And then you have sort of more housing exits for your system to get people out. And so there might be people also who have long stays in shelter or crisis housing and you just need more rapid rehousing capacity for your community. And this is a really good way to add both. And so this is one, I think, extremely helpful way to get people moving through your system, right? So you get people who weren't able to get into shelter because maybe it was high barrier or there wasn't enough. Now you have a low barrier crisis housing situation that has a housing focus and that can get people in. So they're not getting stuck outside in shelter, and they're able to get out.
Great, Cynthia, thanks. We are actually going to take another poll, but Cynthia, before we do that, I just want to, I'm going to highlight a question before our question Q&A part, because it relates back to your joint component presentation. One of the questions is, when you say crisis beds in this discussion of the joint component, do you mean emergency shelter? And I just thought it would be important for you to clarify what you mean by crisis beds.
Yes, thank you for saying that. So the reason I'm using the word crisis beds is because this is essentially, we're not HUD, so I can say this. We, HUD isn't funding shelter beds through the COC program, but essentially crisis beds are shelter beds, right? So you can use them for, for a short period of time. You can use them for a longer period of time. So you can think about them as a way, as crisis beds or emergency shelter beds or interim housing beds or bridge beds. You can think about, and all of those terms are interchangeable. And essentially what you're thinking about is where can people stay for a very short period of time until we're trying to get them housed. And so if that's how you think about your emergency shelter beds, then yes, you can think about this that way too. Some people aren't thinking about emergency shelter kind of in that housing focused way. So I just want to make sure that we're kind of talking about the same thing. So some of these terms are definitely interchangeable, and that's a very good question.
Great, thanks. All right, we're very interested in knowing if folks are going to apply for the joint TH Rapid Rehousing Project. We know that certainly a handful of folks did last year. Given though that this is the second year of this opportunity, we're interested to see if there's some growth in people's understanding and idea of how they can now use this as a strategy in their community. So we're interested in your answering this question. Is your COC applying for a joint THRH project component? Okay, great. Thanks for taking time to answer that. I'm going to go ahead and share. So 31% of you said that yes, you are applying for the joint project. So probably don't have a sense right now how many of those are maybe renewal projects. But and then 42% of you are saying no, and 27% of you are saying you don't know. So again, this is a great opportunity to provide an exit to permanent housing through crisis beds. So really, if you haven't had a chance to think about how this project might work in your community and are not doing it this year, it would be great to think about this early on for hopefully for next year, assuming that they will offer it again. Okay, Cynthia, I think just one more NOFA opportunity here.
Great. So another opportunity to create system flow and do a whole bunch of other cool things in your system are the transition grant. Now, I know a lot of communities have been asking for this for a long time, and hopefully a lot of folks are going to figure out how to use it because the transition grant provides communities a lot more flexibility to better improve system flow by changing grant components and by doing it pretty easily. Now, I know sort of the actual process of taking a project component and then essentially taking that same program, changing the component, and then having that same program operate that component is a whole sort of process in and of itself. But it is, this opportunity that a lot of people have been looking for. So one of the ways, and if you want to know more about how to do the transition grant, USICH has had a webinar that's online that we can, that I think is in our resources tab, I believe, that we can talk to you, or you can just go to the USICH website that talks a little bit more of the transition grants, or you can certainly talk to HUD about kind of how this process works. But we thought that we would kind of just highlight thinking about how to use it. And it's really about where's your community getting stuck? What is your data telling you? For the folks who said that they didn't know, this is a sort of helpful way to start looking at your coordinated entry data. Where are people getting stuck? And your program outcomes, right? So where are people getting stuck? Where are the programs that people are returning to homelessness more? What do people need more of? So for example, you might have some transitional housing in your community, and you're finding that it's either not being utilized very much, or it's not sort of serving the purpose that it was originally intended to serve, and you might need more rapid rehousing. I think most communities need more rapid rehousing because that's what most people need to exit homelessness. And so you might think, okay, well, we have this transitional housing program, and they really are ready to kind of start doing rapid rehousing, and this might be the right opportunity to transition that grant. Do you need less PSH and more rapid rehousing? So we asked earlier, are any of you thinking of reallocating from PSH to rapid rehousing? And a bunch of people said yes, which is pretty exciting. And we think it's exciting because it means that you're really strategically thinking about what you need. It's not that PSH isn't needed. It's that you're looking at your system and figuring out, well, do we need all of this PSH? And did we kind of, has our system shifted a little bit? Especially for communities have, decreased chronic homelessness. Maybe you need more rapid rehousing. If you have a lot of single adults, and I know that there, in a lot of communities, there just isn't a ton of rapid rehousing for single adults. This might be some way to really think about how to add more housing exits for your single adults, because usually that's sort of the population in your community that has the least resources and is the biggest part of your population. So maybe you need more rapid rehousing. Do you need more crisis housing with housing exits we just talked about? So, is there a program that you can reallocate to transitional housing, rapid rehousing? That joint component could really maybe work for a transitional housing program, and really think about how that might work to have those housing exits in addition. And you might need to really, this is not about just sort of changing the name of your program. You would have to really change how it operates. And as I said, HUD has some guidance on how to do this well, but this is kind of how to think about one of the opportunities in creating more system flow.
Thanks, Cynthia. So our last poll for today, we're interested in knowing how many of you are going to take advantage of this transition grant. So if you don't mind taking a minute to answer this poll question. Great. Thank you so much for taking time to do that. So to share the results here. So 8% of you said yes, you are going to take advantage of it. 48% of you are saying no. It's close to 20% of you are saying you're considering it. So that's great to know that you're considering it. And you may just not know yet whether or not you're going to do that. So again, it's a great opportunity to create system flow and to do a little bit of that right sizing. Okay, so we're going to wrap up here. And talk a little, give a few minutes for questions. We have about 8 minutes left, and we'll talk a little bit about what's next. So I'm going to open up the question board for the ones that you've sent us. So just give us a second to just kind of look through here. Let's see. Just as a reminder for everybody, yes, slides will be posted. And so Cynthia, we have a question here. We have a DV THP project that wants to apply for a transition to TH rapid rehousing, but also apply for a new expansion for additional resources for the same project. Can they apply for both transition and expansion? And Cynthia, I believe we had a note in our own notes. So Norm Suchar talked about this at the HUD Snaps Q&A at our July conference, and I believe that the answer to that is no. You cannot transition and or consolidate and expand at the same time.
With the same project, right?
With the same project. And that, from what I remember of Norm's reasoning was, it took a lot just to get some of this stuff happening in the NOFA. So their capacity to do all of that at one time is just not there yet. Doesn't mean it won't be in the future, but if for this NOFA, that is not going to be possible.
And they really encourage you to just, if you really have a specific question about your program, just to contact them and just ask. And in fact, I think Patrick Taylor, thank you for leaving this comment in the chat box here. He, Patrick, I think, is a TA provider, and he just wanted to make, I think, important comments about regarding the HUD Exchange. Ask the question help desk if you're not using that. If you do have questions about the NOFA or eSNAP functionality, or anything around, I think this is a good question that was just asked, submit them to the eSNAP help desk, not the COC help desk. And when asking a question, be as descriptive as possible. Especially when you're having an issue with your eSNAP stuff, but particularly if you are trying to figure out some of these project questions, then you'll get a quicker response.
Great. There's a question here about, it's a little bit more open-ended, but some thoughts around, currently we have PSH units in our area that we consider high barrier. Any thoughts on this?
Yeah, so I think if you kind of flip back to, I think one of your slides, Christy, just talked about how to evaluate how your PSH programs are functioning. And I think the sort of PSH projects are meant to be housing first, meaning they are meant to not have prerequisites for entry, and are meant to be very low barrier, right, to get in. I mean, they're for the most vulnerable people, and the whole sort of point of permanent sort of housing is to help people who have the most difficulty to exit homelessness on their own. If you have providers in your community who have higher barriers, we would encourage you to really, and if you can't do it this year, to next year, really look at using in your scoring tool and your program evaluation for when you're tiering projects, have this be a question or a list of factors that you're using to evaluate your PSH. So a number of questions you can ask are, are you targeting people who are chronically homeless? Do you have prerequisites to get in? And if so, what are they? A lot of communities ask for the PSH projects policies and procedures, who they're serving, what the percentage of chronically homeless folks are. You should be targeting all of those beds, especially the turnover beds, to people who are chronically homeless, which means, a high barrier kind of program isn't going to really work well because you're not going to be able to get in often. And the sort of way to kind of move that is talking to the programs now. If you're still creating your tools, it's something you can look at or kind of still review and rank, but and sort of say or maybe you already have a question about how, the NOFA is asking projects to be housing first, and you could use that sort of as a way to say, what, we have to reallocate funds to programs who are more low barrier to serve the people in our community who need this intervention. And, if you want to make this transition over the next year, you start working with those providers to say, look, we're going to really need you to lower barriers if you're going to want to be competitive in this NOFA process. And that's what HUD wants, that's what the community wants, that's what people experiencing homelessness need. And so that, I think, is one of the best ways to do this, is just to sort of use it as one of your program evaluation tools and outcomes. So if you're looking at people who are, what outcomes for PSH often look really, really good, especially if they have higher barriers to get in, right? So if they're serving folks that maybe are who have less need, they might have really high retention rates and low returns to homelessness, but that you have to look at that outcome in conjunction with who they're serving and what their barriers are to get in.
Great, and I just want to piggyback on that. Another question came up about how to include consumer feedback or consumer surveys as you evaluate the PSH project, whether or not this should happen in the program or the systems level. And I know in some communities that I have worked in and wrote NOFA applications for, we had a narrative part of the project application where the provider had to show the ways in which they engaged consumers in feedback and how that feedback impacted the way that they transition their program services and program delivery. So looking at that at the program level is an opportunity also to see whether practices are moving towards a low barrier approach. I just want to, in regards to time, just a couple of things I want to highlight. We did not. One of the questions was about why just the focus on PHAs in terms of the move-on strategies. Why not multifamily? But the answer to that is time. We did not focus on multifamily, but as Cynthia shared, HUD is providing technical assistance for PSH move-on for both incorporates partnerships with PHAs and multifamily property owners. So absolutely, wherever you can get a partner that can provide those units, all those opportunities should be explored. And just a comment for those communities that have PHAs that aren't particularly or are partnership averse, I guess to say, where you're having some difficulty in forming those partnerships. There is no silver bullet answer to that. It is just constant engagement with more than one person. And over time, sometimes it's just time that helps to make that happen, and the right people in the right job at the right time. So just want to encourage you to not give up on your PHA, to just constantly engage them in this opportunity. The last comment I just want to highlight here, we had someone who noted that they had submitted an AAQ about the required dates in the NOFA regarding notice, and this person said that all applications must be received by August 20th and applicants should be notified by September 4th, not September 3rd. So thank you, Karen, for that. We'll definitely go back and double check that and have the right date in the final slide deck. So what I'd like to do is just give you a couple heads up as to what's next. In particular, we want to share some information that Norm shared at the July conference, that HUD is going to announce a NOFA for HMIS. This is a small notice of funding availability for $5 million. And kind of the conversation in the room was, you know, COCs who are struggling with low performance, this NOFA is for you to help with that data, that data work. So just a heads up for that. Also, we have some upcoming blogs, as Cynthia mentioned before, that will be out in the next week or two. We're going to have a blog on the DV bonus project and a blog on how to think about racial inequity with regards to this NOFA. So please be on the lookout for that. In the chat section of the webinar, of this webinar, in your navigation bar there, webinar, an email letting you know that this recording is up on our website, including the slide deck and with some additional resources that we've highlighted here. We appreciate your time and know that we are thinking of all of you as you finish up this NOFA process, and we hope that the next next 2 months are smooth for you. So thank you so much for joining us today. Have a great day.